Welcome to Metacognition Mondays with Antony Lo, a podcast for thinking clinicians. This is episode 1 of season 1, The Foundations of Metacognition. I'm joined today by F Scott Feil, who is a professor in the USA. Welcome, F Scott.
Thank you. I'm always happy to be here chatting with you, Anthony.
Thank you, thank you. F Scott invited me to start this podcast for HET, Molly, the Healthcare Education Transformation Podcast, and for the Metacognition of Leadership Institute. So, season 1, episode 1 is, what is metacognition? So in this episode, what we're going to do is actually unpack what metacognition is, and we're just going to discuss things. The 3 key talking points will be, what is metacognition, the difference between knowledge and regulation, and why. The third one is why it matters in health professions. So for the first one, we're going to go, what is metacognition? So metacognition, by its definition, is just thinking about your thinking. It's a term that was introduced in the 70s, but honestly, centuries, millennia of thinking about your thinking has occurred, all the way back to the ancient Greeks, no doubt even earlier. It involves an awareness and control of your own thinking processes. So you need to know that you're thinking about things, and you need to be aware that you have all of these BAMs and bars, that I call them, beliefs, attitudes, meaning, and stories, as well as biases and assumptions. If you don't acknowledge that you have these, it's really, really difficult to interact with other people, because you need to understand not only your own BAMs and bars, but what their possible BAMs and bars are. So when interacting with people, which is what we do in healthcare at least, you need to understand where people are coming from, the context in which you're interacting. So important. Now, cognition is, there's a difference there between cognition and metacognition, because cognition, just thinking, this is how you, for example, come to a diagnosis. Metacognition is more about, what was I thinking about? How did I arrive at this diagnosis? Why did I go down this track? Why did I choose these things? Why were these things more important in their presentation than other things? And then, even more importantly, what did I miss? What did I discount? What did I put too much weight on? All of these reflections and thinking is the metacognition part of metacognitive thinking, critical thinking. So it's important that that distinction is made, and it occurs not only before you do a task, but during and afterwards too. It's the planning of what you'll do. It's the monitoring while you're in it. And it's the evaluating after completion. So not only is it in clinical care, it's also in education, it's in communication, it's in personal growth. And I think one of the most important pieces of advice that I wish somebody gave me is not to leave my work skills at work. I was taught, leave your work at work so that you can come home and be present at home. And I know it sounds stupid. It's so bloody obvious. But I actually have good skills with a client. One of my family members said to me, I wish you were as nice to me as you are to your patients. And it just struck me that, wow, I really don't use my work skills at home, because in my head, there's this leave work at work and home is home. And it's almost like I become a different person. And it's not deliberate. It just is what it is. And so that's the metacognitive part. Thinking about that, reflecting on that, realizing that, yeah, that would have been much better if I received that advice right up front. So, common examples. Realizing you don't understand something and deciding to reread about it. This happens to me all the time. I'll do it in front of a patient. I'll say, this is what I think, this is what I've learned, this is what has changed over the years, and give me 1 second, I'll tell you if anything is different. and I'll just bring up the latest systematic reviews that I can find. Because, it's easier to build on knowledge that you already have and then just adjust. Another example is questioning whether your first impression of a patient was accurate. Oh, I've given up trying to pick things. I was taught to watch a person walk in and try to guess what's wrong with them. Don't read the form that they filled out first. And I see a lot of that on especially Facebook groups. They say, oh, I've got this person on my schedule and they have this, 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 and this, and what should I do? And I keep thinking, have you already seen it, or are you just planning? And they're really, really anxious because they don't know what to do. And so the first thing you should do is sit down and listen to the person, and then your normal skills will kick in and you can fill in any gaps, because if you hype it up too much before you get there, you will burn out just in thinking. Anyway, a third example is reflecting on a teaching moment and how to improve for next time. Teaching moments, some people call them mistakes, poor decisions, incorrect decisions, just different decisions. What could you do differently next time? Because building on those is the way forward. Nobody's perfect. Nobody's perfect. I know that I'm not perfect. So I look forward to a lot of these examples. And Scott, tell us what you think some other examples might be in what metacognition is.
Yeah, I think the big one for me is I used to be very pedal to the metal, go, 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 work harder, do more. And metacognition for me really helped slow things down, helped me reevaluate my decision making, come up with several different options, and then reprioritize and kind of put the best option first and then try that out. And really thinking about which lever to pull to get the most bang for my buck, right? So if I'm given three different options and all three are potentially good ones, which decision should I make and which path should I go down to get the best ROI, whether it's for patient care, whether it's for teaching students, whether it's for business and operations, just really slowing down and thinking more before I acted and worked harder and did more, right? So it's almost like doing less, but getting more impact out of the thought process and decisions that you make so that you don't have to work more, if that makes sense.
I love it. Just becoming more efficient and using what you know already. There's a saying, it's not what you know, it's who you know. And in a lot of ways, I actually believe that. It's just the pragmatist in me. But knowing what you do know is a really important skill to have. You got to have a base level of skill there, a base level of knowledge there so that you can build on it. And if you don't have that, that's okay, because you already have something, right? People have something, and you can just build on whatever that next logical step is for you. So I'm looking forward to that. Let's move on to the second talking point. We've already discussed what metacognition is. What's the difference between metacognitive knowledge and metacognitive regulation? Because those two are really, really important. And so we're just going to discuss those two next. Metacognitive knowledge is what you know about how you think. So you can have what's called declarative knowledge, knowing that you struggle with names or patterns. People ask me all the time about patterns. It's like, I don't know what to tell you. I just see the person as they are. Whereas other people just will come up with patterns that they see all the time. Procedural knowledge, knowing how to use reflection tools. So another metacognitive knowledge piece is procedural knowledge. Journaling, self-questioning, just sitting there looking at the clouds and thinking. It's one of my favorite things to do. I love reflecting and thinking. And in a lot of ways, I see things like those logic boxes or decision trees, flow charts, and things like that in my mind. I hate writing them out, but I love them in my mind. I'll do the boxes for the logic boxes. The third one in metacognitive knowledge is conditional knowledge, knowing when and why to apply thinking strategies. It's not cool to sit there and think for 15 minutes while the patient is sitting there in the seat or lying in the bed while I do some reflective thinking. Yeah, that's probably not the right time to be applying that particular thinking strategy. And I have a particular plan. People always tell me and they ask me, how do you know what to do? You always seem like nothing phases you. And I said, well, I learned very early on that I just need to have a plan. And if I've got a plan, I know what to do next. And the plan is very, very simple. If somebody's getting better or they feel better, just keep going. Just keep going. It's a simple plan. It's the easy one, right? Most people know this one. What if things get worse? This is another simple one too. Like, just stop. Like, if you're meant to push on, okay, we can think about it, we can discuss it, and then we can continue to push on. But if people are hurting, just stop. And then the third one is they don't feel better, they don't feel worse. They're no different. To me, that's the worst result. At least if they're feeling worse, I know that I'm affecting them. If they feel no different at all, now I've got a choice to make. I either keep going or I choose something different. And so every time something happens that I don't expect, it's going to land in the, is it better, is it worse, or is it the same category? Sometimes they just say, I don't know, it's just different. That's cool, it's different. Let's just keep moving. And that's how I have a plan for things, even with a lack of knowledge, because from there, it's like, well, that made you worse. Let's stop. It does not seem to be within my scope. So what we're going to do is we're going to write a letter. We're going to send you to the doctor and ask them to figure out what's going on, because all the PT things that I did have indicated that that should not happen. So we move on from there. That's metacognitive knowledge. Metacognitive regulation, what to do, what you do to control and refine your thinking. So the regulation part is what you do about it. The metacognitive part is what you know about it. So one thing you can do for regulation is planning, anticipating how you'll approach that clinical task or goal. It's always helpful to have a plan so that you can change the plan. Lots of people have a plan of, I'm just going to see how it is. And that's usually born from a confidence of you actually do have a plan, like what you'll do if things turn out a certain way. Monitoring. Another thing that you can do is just staying aware of whether your strategy is working or not. That's a really helpful thing to do. And then the last one will be evaluating, judging that outcome and adjusting for next time. So you can plan for it, you can monitor throughout, and you can evaluate. And these are things that you can do on the go. Thirdly, knowledge and regulation, they do work together. Knowing what helps you think better is useless if you don't use it. Knowledge, I've often said that knowledge is rarely the problem. In our world of Google and ChatGPT and all the other AI tools that we have at our disposal now, knowledge really isn't the problem. It's thinking about how to use that knowledge. And so more than ever, we have more knowledge than we've ever had access to. Before, we used to have to ask people and then evaluate whether what they're telling us is useful or helpful or not. Now we can just fact check people right on the spot. It's annoying for people, apparently, when I do that. So I try not to do it too often. It's just how I am, right? I just want to know the truth, whatever that is. Regulation without knowledge is trial and error with limited insight. So it's great if you use these regulation tools, planning, monitoring, and evaluating. But if you don't actually know what's going on, you're just going to be very narrow in your scope of thinking. That's why together they need to work together. So, as clinicians and educators, we often see gaps in one or both areas in ourselves and our students, our course participants, our colleagues. In fact, I would argue that it is easier to see the faults in other people than it is to see the faults in ourselves. What do you think about this sort of thing, Scott? Tell us about metacognitive knowledge and regulation as you see it as a PT professor at university. PT.
Yeah, I've realized very early on in my career that I transitioned from English major to physio, and so that was tough for me because I was going from liberal arts to math and science type stuff, right? And so I had to put my ego at the door a long time ago and realize I was going to need a lot of help. And so I just tried to go into every experience and interaction with somebody as a learning experience and one to, try to learn more, better myself, take away more, whether it was building the foundational knowledge or increasing skill sets. And I like to we talk about this a lot on this podcast, but the Dunning-Kruger effect, right? Where you come out and you think, oh, I know it all, I know everything, I'm great at this. Then you realize you come to a point and you realize, oh, I actually don't know it all. I don't know much of anything. I got to start working again to like get my knowledge back up, right? And so, it's interesting because, like you said, we do live in the age of information, right? We're getting information overload 24/7. And that can be a good thing, but it's really how we stop and start to filter out the information that we need to then apply. And I really like the idea and aspect of taking it one thing at a time, specifically for what you need right then and acting on it, right? So I think that metacognition can definitely help the filtering process and help us figure out what we need to know, where we're getting the information that we need to learn, and then again, taking that next step and really acting on it, right? And implementing whatever it is we just took and how can we apply it. So I really like where you've kind of merged those knowledge and regulation together to then start becoming better at whatever it is we're trying to learn or get better at.
Yeah. And it really brings us into that third point, right? Of why it matters to those of us in the healthcare profession. Because if we really think about it, it's about where the rubber hits the road. And this is where I want this podcast to hit hard. Why does it matter in our professions? And so, clinical reasoning, it is complex. It is. There's a lot of factors that go on. There's a lot of things that confuse. There's a lot of things that seem contradictory. We're trying to marry a whole bunch of assessment findings into one to come to a diagnosis, or at least to see if there's been a progression in a known diagnosis. And so that's the metacognition thing. That's the thing that's going to help us manage that complexity. It is complex. It is nonlinear. You watch people and they just jump all over the shop uh, in their reasoning. And then you watch other people and they're so structured. And it's like, I know you want to get through this list, but you just moved past a massive piece of the puzzle, you know? And where's that balance? And that's where the metacognitive piece comes in, I think. I think if we do that well, we're going to have better decision making. And, under pressure, there is nothing like I remember when I first did it, there's nothing like doing an assessment in front of somebody live, in front of 30 people live, in front of a bunch of your peers, in front of people who are more expert in the field than you are. Like, it feels very scary. But with practice, you just get comfortable with it. I've got my plan. What do I do if it's same, better, worse, or different? And you can always ask questions. You can always ask questions. The other thing that you can do is just remember that unless, you're really stuck with certain conditions from insurance companies, you don't have to finish everything in the one session. I don't work with insurance companies very much. I would say 95% of my caseload is non-insurance. So people just come and pay their money and cash-based is what they call it in the US. Metacognition enables adaptive expertise. If you understand those core principles, then you can adapt in a very flexible way when something comes along. Instead of being knocked over from the rigidity of following rules and procedures and recipes, you can absorb that hit and just rotate and continue on no matter what's going on. That's what I love. I love that feeling of, whoa, that was different, but we keep going. I think metacognition can really help with that. So if you feel lost, like, whoa, that is not what, nobody's taught me what to do if that comes up, or I know what to do with this diagnosis, for example, pelvic organ prolapse, but pelvic organ prolapse with an underlying condition of, I don't know, something else, like they've just had kidney removal surgery. You know, I've seen people literally ask, I don't know what to do in that situation. And they get stuck and they get anxious. I think understanding those core principles and flexibly applying them is the key. Reflection improves diagnostic accuracy and reduces bias. I think this is true. You know, being able to identify your biases and then control for them, like account for them, is super important. I will often tell people after listening to the subjective, I think I know what you have. I think you have a knee problem, for example. I think the problem is at your knee. Because it is at your knee, and the reason why I'm telling you, I have to go exclude a whole bunch of other things that I don't think you have, because I could be missing things. If I just go straight to the knee because I think I know what's wrong, I will find all the evidence I need to convince myself that I'm right, and I could be wrong. So what I'm going to do is I'm going to assess your lumbar spine, your thoracolumbar-pelvic complex, hip complex, and I'm going to check your feet and your ankles as well. And if all of those things test negative to causing your problem, well, then I feel more confident that the knee really is the source of what we're dealing with. So I think it's really important to do that. I had a patient recently come to see me, and he'd been seeing somebody else for 8 months after a bike accident, fracture, and operation, and he still had this pain 8 months later. And you know, it would seem very obvious that his pain over the fracture is where the problem is. He actually had a back issue. So once I addressed the back, his pain got a ton better, the most amount of relief he's had in months. It's that sort of thing that needs to occur early so that we can help be accurate in our diagnosis and account for our bias. So I think metacognitive thinking, it really does enhance the learning that we get from our experiences, not just accumulating more experience, not just reinforcing the recipe that we've learned. I find it difficult to see the general. I'm very individualistic, and I have to account for that problem. Sometimes I need other people to just tell me what the general principle is. It's also a protective factor against burnout. And if you've ever heard me talk about these things, you know this is true, that I believe it. I honestly think burnout has at its very heart the idea that the pressure is on us to fix people. And if we change that idea from being a fixer to being a facilitator, that takes the burden off us. We're facilitating their healing. Yes, there is a lot of responsibility for us to do our job well. And some people do it better than others. I'm not saying that it doesn't matter. Of course it matters. But my identity as a person is not tied up in my success as a PT. It just isn't. I'm still worthy at the end of the day of love and respect from everybody, whether I'm, you know, super good at my job or good at my job or acceptable at my job. Even failing at my job and needing to change professions, I still deserve love and respect. for that. Your self-worth shouldn't be tied up in things that can be taken away from you. So I think that's super important. Uh, metacognitive thinking, metacognitive processes will foster purpose, insight, and self-correction. And ultimately, it makes us safer. It makes us more curious. It makes us more thoughtful clinicians and educators. And that's really the key. So that's why I think it's important. In teaching, it helps us model and develop critical thinking in others. I hope this comes through in my passion for metacognition. In patients, it builds autonomy, health literacy, and behavior change. I hope that's true. I want people to be empowered to make decisions about their own body and about their own care. And I always try to make sure that they understand that my job is to make sure that they don't need me. That's the key. And my call to action for you would be to start thinking about just one part of one session, be it with a client or be it with a class. I just want you to just think about what you're telling yourself and why. Just try to see what some of your assumptions are about in your thinking and why you might be thinking that. It'll be interesting. Please leave a comment in the notes. F Scott, putting you on the spot here. Have you done this sort of thing before where you thought about what you're telling yourself and why?
Yeah, definitely more so in the last year. Especially while I'm teaching a class or a course or educating educators, if I start to get that like blank glare, that glazed look in the eyes, I start thinking to myself, like, am I even good at this? Like, are they not getting it because I'm not teaching this well enough? Maybe I need to change directions. Is there a different way to teach this? Like I almost get a little bit ahead of myself sometimes and start reflecting while it's happening, instead of just kind of sticking to the plan and going with it and see what happens and then, course correct after the fact. So I would say that in the last year, especially when it comes to education, started thinking about what I'm thinking while I'm educating, and I think it's definitely helped me, stay curious and think of other different ways to think. Um, and given me a better layout and plan as far as how to have two or three different options in the back pocket. If one doesn't go right, you go to the next. If that doesn't work, try a third. So it has definitely made me more thoughtful about my planning and how I approach education, more curious about what works and what doesn't and why. And then, overall, I just think it's made me a better educator. Whether that's healthcare education, whether that's business education, whether it's life education. I've been seeing a lot of it creep more into my family life and how I'm trying to raise my kids too. So, it's been a blessing for me, and one that I wish I had learned earlier in my career.
Beautiful. Thank you for that. That's it for this episode. Please jump on board at hetmolly.com if you're interested in that. If you like my style and my content, please go to antonylo.com. I have courses and mentoring available there, and I'll look forward to chatting with you in the comments. Please like, subscribe, and share it with your friends so that we can actually get a whole bunch of us going, just thinking about our thinking and helping to build each other up. Thanks
Yeah,
very
and
much.
Anthony, if I can just interject real quick here, this is why I love having you here and love listening to you because you literally take the complex and make it simple. And that's what I need. When I'm learning something, I need it to be simple. I literally the one of the big pushes for me to reach out to you and try to, figure out how you do this was sitting in a national conference watching a pelvic floor presentation that Antony was doing, something that I have no expertise in, no knowledge in, don't really care about, don't want to learn. And by the end of it, not only did I understand it and grasp it, but I literally was ready to take it on Monday back to my patients and some of the geriatric population I was working with at the time to implement with them. because I could see how easy it is to do some of this stuff because I just always assumed, right? I made the assumption that it was difficult. I didn't have the knowledge base. I wasn't good enough at it, but you just made it simple enough. You took the complex, you made it simple, and that was something that was very applicable and actionable for me. So thank you. I'm excited. I can't wait for the next episode. I'm itching already.
Beautiful. Thanks for that, F Scott. And again, if you like my style and you want the complex made more simple, please go to antonylo.com or mypteducation.com. Thank you.